Hello, my name is Joe Lipton. I'm an anaesthetic registrar from South East London, and I've made this short video to tell you about an exciting educational project that I'd really like your help with. You've received this video because you're about to start your anaesthetic novice period. Whether you're heading for a career in anaesthesia, emergency or intensive care medicine, the novice period is a mandatory part of your training and will provide you with a solid foundation in anaesthetic practice. Once you've completed your novice period, you'll be able to cover the anaesthetic core trainee on-call rota in your hospital and deliver anaesthetic care for low-risk cases with distant consultant supervision. The novice period is the first 3 to 6 months of anaesthetics training and involves completion of the Initial Assessment of Competence, or IAC. To pass the IAC, you are required to complete this list of 19 workplace-based assessments, which underpin these learning objectives. Critics of the IAC argue that using multiple competency assessments can become a box-ticking exercise. In 2017, the General Medical Council produced this set of standards for postgraduate medical training in the UK. At present, the Royal College of Anaesthetists are updating our curriculum to meet these standards. The new curriculum will need to describe fewer specialty-specific outcomes to help doctors better understand what is expected of them. This means moving away from a competency-based approach in which individual skills are assessed in isolation to one which focuses on training outcomes that better translate to the expectations of the workplace. One example of an outcome-based approach to curriculum design is the use of Entrustable Professional Activities. EPAs are used in several postgraduate training programs in Europe and North America, but have yet to be implemented in the UK. Our group have devised EPAs for the anaesthetic novice period. To do this, we decided what clinical tasks a core trainee would be expected to complete with distant consultant supervision while working on call. These are our two EPAs for the novice period. On the right, EPA 2 is the anaesthetic care of a straightforward low-risk patient who needs an urgent or emergency operation. These cases are extremely common and form the bulk of the emergency workload in theatres. EPA 1, performing an anaesthetic pre-assessment, is fundamental to any anaesthetic care episode. As you can see, these skills are applied in the pre-operative phase of EPA 2. Sometimes, though, you'll be asked to pre-assess patients who are too sick or too complicated for you to anaesthetise on your own. The expectation is that you'll learn to assess anaesthetic risk, helping you to make safe judgments about your own scope of practice and allowing you to flag these patients up to your senior colleagues. We've created a workbook containing detailed descriptions of each EPA, along with a range of learning activities for you to complete during the novice period. Progression through an EPA curriculum is framed around the gradual withdrawal of consultant supervision as you achieve competence in each task. Your supervisors will use their expert judgment and experience to manage this progression with you. When your supervisors feel you're ready and you've completed all of the required learning activities, you'll be awarded with a statement of agreed responsibility for each EPA. This is a formal recognition of your progress and represents entrustment of responsibility. The novice period lasts for 3 to 6 months, and it's important to note that everyone learns at their own pace. Some people may need more time or extra support as they assimilate their new skills. Our priority is that everyone is given the support they need to practice safely. Your consultants will be regularly reviewing your progress and will guide you through the entrustment process. For this pilot, we want to help facilitate your learning as much as possible by taking a different approach to workplace-based assessment. We're using supervised learning events in order to chart your progression through each EPA. SLEs are low-stakes episodes of feedback and reflection designed to capture the learning which takes place every day in the workplace. The workbook contains lots of these templates, which we'd like you to use to document the learning conversations you have with your supervisors. There are no pass-fail assessments in the programme, and instead the emphasis is on regular participation. In a moment, I'll outline how to plan and complete your SLEs for each EPA. There's also useful advice about this in your workbook. These are 2 dummy SLEs for illustration. On the left is an SLE template from the beginning of the novice period. It documents a learning conversation about managing emergence from anaesthesia. In the right-hand SLE, the trainee is observed managing a whole case from start to finish and has reached the expected level of practice for entrustment. We use supervision levels to allow consultants to give global feedback about your performance, enabling you to benchmark yourself against the expectations of the programme and document your progression. I'll now briefly outline how we suggest you use SLEs to guide your learning during the novice period. For EPA 1, you'll start off by learning the elements of the anaesthetic pre-assessment, building on history-taking skills you learned in foundation training and applying them to an anaesthetic context. It's useful in the first week to observe consultants performing pre-assessments and also to have your own practice observed. These encounters can be recorded as SLEs in your workbook. Over the subsequent weeks, we suggest that you focus on becoming fluent in straightforward cases before directing your attention to the more complex and high-risk patients. SLE should focus on detecting these important risk factors and beginning to understand how they impact on perioperative planning and care. This EPA fits within a wider context of perioperative medicine and more advanced optimization and risk stratification, which are covered later in anaesthetics training. EPA 2 is the more challenging of the two, and the learning curve will feel steep at first. We've created this fishbone diagram to show the range of new skills that you'll need to assimilate and apply in order to practice safely. We suggest that you use your SLEs to focus on individual elements in isolation at first. The coloured boxes around the outside of the diagram are called anaesthetic non-technical skills. These skills are all vitally important for safe clinical practice and can also be a useful discussion point for your SLEs. As you become more confident, your supervisors will encourage you to begin to practice more independently, stringing the individual elements together. Your SLEs can be used to gain useful global feedback about how you're developing. We've left the exact number and nature of your SLEs intentionally open-ended. You're all adult learners, and you will all develop a clear understanding of your own learning needs. In order to progress through the programme, we ask that you complete regular SLEs to document your learning process. While the SLE system offers some freedom to manage your own learning, we have included a few mandatory additional activities to make sure that you cover the really important stuff. Managing critical incidents, though rare events, are a core part of training in anaesthesia. In particular, difficulties with airway management can occur at any time with potentially life-threatening consequences. As a minimum, you must attend teaching on the 2015 Difficult Airway Society guidelines and take part in skills training for the management of failed intubation. These learning activities may be completed on your novice courses or through simulation. You'll find out more about these activities when you start in post. In addition, you must also demonstrate your ability to check and safely operate an anaesthetic machine. You will encounter several new classes of drugs when you start your anaesthesia training. Responding to requests from previous trainees, we've included some prompts to discuss the important classes of drugs with your supervisors. To help you structure your time and give you a roadmap for progression, there's a timeline in the workbook showing a rough week-by-week guide. As you complete your SLEs and other learning activities, your consultants will be monitoring your progress and guiding your development. They will use these observations to make judgments about how much supervision you require. At the conclusion of the novice period, you will have reached supervision level 3 for each EPA. The faculty of consultants working with you will use multiple sources of information to manage your progression through the novice period. This will include reviewing your SLEs and discussion with members of the department who you've worked with. Your simulation and critical incidents training will also provide a useful source of information for your supervisors. The primary aim of the entrustment process is to support your learning and development. Transition to on-call working and the conclusion of the novice period must be managed safely, both for you and your patients. It's really important to remember that everyone learns at their own pace. If your supervisors feel you need particular support in any area, they will explain this to you and help to guide you through. As this is a pilot project, at present the initial assessment of competence that I mentioned earlier is still a mandatory requirement that will be needed for you to pass your ARCP at the end of the year. To reduce the burden on you to a minimum, we've arranged with all the departments involved in the trial for you to follow the EPA curriculum primarily. The required assessments for the IAC can then be backfilled. We've created a simple mapping document to show how the learning activities for the EPA curriculum relate to the IAC. The educational leadership in the region are behind this project, and you will be supported as much as possible to participate. We really hope that you'll enjoy taking part in this project and that you'll find it helpful as you start your training in anaesthesia. The Royal College is currently preparing to launch their 2020 curriculum. To meet the GMC's requirements, it's very likely that EPAs will be used as the building blocks. We are in a unique and exciting position of being the only trial in the UK which will inform this curriculum change process. By taking part, you'll be contributing to shaping the future of anaesthetics training. To facilitate this, we'll conduct a thorough evaluation of our EPA curriculum over the coming months. We hope that you will help us by participating in that process. If you have any comments, questions or problems of any kind, please do not hesitate to contact any of us in the study team, as well as your educational supervisor or college tutor. We will send further information to you by email in due course, and you will receive a hard copy of your workbook at your departmental induction. Please take some time to look over it carefully. Good luck with your novice training, and thank you for listening.